Thank you. We now recognize the gentlelady from Georgia, Ms. McBath.
Thank you, Mr. Chairman. And first, I want to give my deepest condolences to the Rockwell family. I am so sorry for your loss. I, too, have lost a child. And, you know, it's just so heartbreaking because it's not the natural order of things. So I do give you my deepest condolences. And for many across America, this epidemic is just a symptom of neglect. We have heard how far-reaching and fast-growing this public health crisis has become. What started as a plan by big pharmaceutical companies to profit on the pain of millions, a plan to shroud the addictiveness of these drugs in sales tactics and consultant speak, has changed the course of our country and the Americans who live in it. We know the facts, they've been spouted all day. We've heard many of them here today. Millions of Americans addicted to opioids led us into an era of millions of Americans addicted to heroin, fentanyl, a drug up to 50 times stronger than heroin, pushed on our people by cartels most often supplied by the PRC, and has only increased these deaths of despair. We know the facts, but we don't always know what goes on in these homes. When we zoom into a home, when we see a family, we see parents that are shattered by a loved one, lost in the grips of a drug that has consumed them. We see the wife in West Virginia, whose husband came home in pain every night from work, that left them battered and bruised. The overprescribed opioid that was supposed to be a cure for the pain became the cause of it. As addiction took hold, opioids were replaced with heroin, heroin laced with fentanyl, and now 2 children are growing up without a father, supported now by a single mother who just saw the love of their life descend into darkness. We see the father in Florida who just dropped his son off in his freshman dorm room. Since he was a little boy, he had always followed the rules. A quarterback on his high school team, he had always been the calm and quiet type, but a concussion followed him to college. Now he was a child away from home, surrounded by his peers. He spent a night with his friends doing what many college kids do. It took one pill to overdose, and now the father who spent 18 years raising a son he could never be more proud of would never see his boy again. We see the daughter in Georgia bullied in her high school for being too fat one day and too thin the next, for trying too hard in school and not hard enough on her looks. When a friend promises an escape from the terror in her head and the pain in her heart, she accepts gratefully, until the drugs had a hold on her, until the painkillers decided what she was doing and when she would do it. Her overdose on heroin was called a death of despair, but that only scratched the surface. Her mother and father are now forced to celebrate her birthday at her gravesite. There's a heartbreak only reserved for those who question whether they've done more as a parent to save their child, a spouse, a child. And when you focus in on a community, when you enter a home filled with that heartbreak, which I do understand, you can only begin to understand the human cost of this crisis. These drugs have profited on pain and left only death and despair in their wake. This isn't the future for us as Americans, and this isn't time for politics. This is the time for progress. And what we do here must help to solve this crisis, not score political points. So please, Dr. Singer, what can we do right now that will give us the best chance of saving American lives, ending this epidemic, and keeping our families together?
Well, Congresswoman McBath, thank you for that question. As I've said previously, and this is under the purview of this committee, I think we should focus on trying to make the black market less dangerous for people who are going to go into the black market to purchase drugs by allowing them to be able to use, for example, test strips to test to see if they think they're buying a Percocet and it turns out it's fentanyl. We could help them by letting them know that and maybe avoid taking it. Also, we should remove section 21 U.S.C. section 856 so that harm reduction organizations around the country could set up overdose prevention centers to prevent people from overdosing. And also in those centers, they test their drugs before they use them, and they use them with clean needles and syringes, which they have to return. And it's outside of the public view, so people don't have to watch people use drugs. So these are things that this committee could address. Also, In many countries, Canada, the UK, Australia, since the 60s, primary care physicians have been able to prescribe take-home methadone. But in this country, we have this very burdensome process where in order to use methadone, which is a very effective treatment for addiction, you have to go to a special clinic. You sometimes have to travel miles. You have to take it in the presence of a clinic staff because you're stigmatized as somebody who can't be trusted. Whereas if you were able to during the pandemic, actually, they allowed take-home medication. We saw no evidence of diversion or misuse of the methadone. If we allowed primary care practitioners to prescribe methadone to treat substance use disorder, then there'd be many more avenues where people can access methadone treatment.
Thank you, and I yield my time.